We're working with the Alternative Law Forum, and the ALF is a legal space that provides legal assistance and support to individuals and communities that might not have it otherwise. So individuals that live with HIV/AIDS, or parts of the LGBT community, former sex workers or current sex workers, people that wouldn't necessarily have access to those legal services otherwise. And that's kind of who our organization reaches out to and tries to help.
We're working with the National Institute of Speech and Hearing in Kerala, India, and I'm working with Kevin Smith and Elise Guilfoyle. We are working on the website, working with NISH to create more accessibility for those who are living with disabilities to access the relevant information and services to help maintain and improve their lives.
We're working with Jaga, which is a hackerspace, makerspace in India. They're based in Bangalore, and they have been tasked with doing research on the craftsmen and crafts processes of Hampi, which is like a UNESCO World Heritage Site about 6 hours away. And so they are doing research on the tradition of crafts work there, and we are doing a website, and we're also doing a museum installation so that people can come and look and see what they've done and see the crafts up close.
I am working with an NGO called Digital Green. It's me, Edgar, and Krishna, so there's 3 of us, and we're going to be in New Delhi. What Digital Green does is they partner with other NGOs throughout India, and now also they're starting to move to Africa, and provide a facilitation training for farmers in villages. They teach leaders in the villages how to hold these big sessions where they show videos and mediate discussions about new farming practices and improve the quality of their lives and improve their livelihoods.
My group is helping the Indian Institute for Human Settlements. We are working on a web application that will help digitize demographic and spatial data for India. Our contribution is actually the first step in a much longer term process where they'll have a lot of demographic data.
Our main goal is to create a dashboard for a hospital to use in India. So this dashboard will have patient surveys and will have their level of satisfaction with the hospitals. Now this can range from the nurses to the rooms to the actual facility itself. On the other side, we can have a map of the various hospitals in this hospital system, which is the Be Well Hospital Group, which is located all around India. And so this dashboard would show how these other hospitals in this group are doing as well, by clinical effectiveness, talking about physician efficiency, returns to ER after a certain time, how well the physicians are doing. This dashboard will be a central point for all physicians to look at to see how these hospitals are doing.
If you told me, a couple of years ago, or even when I began this program, that I was going to be going to India to work on making maps out of census data and survey data and economic data, I wouldn't have believed you, because that was just so far outside of what I thought of myself and what I thought about my talents and what I thought about what I wanted to do.